kind of recovery period?
Yeah, that's a great question. I think that that's one of the things that differentiates the ablation procedures. So for surgery, typically it's a 4 to 6 week recovery just because of the incisions. It takes a while to heal and get back to full activity. With radiation therapy, depending on the intervention, it can be either treatment over 10 days or treatment over 6.5 weeks to even sometimes 9 weeks. And those are typically daily treatments, 5 days a week or so for some of them. So you're looking at a month and a half really for treatment and recovery. And even with the short interval of radiation therapy, there still is some fatigue and recovery after that for a couple months. With the ablation therapies, pretty much all of them are one day, same day outpatient procedures. So you can have general anesthesia. You could have even some groups do it with spinal anesthesia in an outpatient clinic, not NanoKnife, but some other technologies like cryoablation or HIFU. But patients go
NanoKnife is done under what anesthesia then?
general anesthesia, because it uses electricity. It can cause activation of the muscles in the pelvis. So we need people to be asleep for that and paralyzed. But we often do that anyway for many of the other ablation technologies that we use. But in general, in terms of the recovery, it's go home the same day. I personally leave a catheter for a week because I think that minimizes concerns with urinary retention. A lot of men are very concerned about a catheter. I can tell you it is annoying and a change. It is really very bearable, and having it in for a week is much better than having it out earlier and not being able to urinate and having the discomfort of being in urinary retention and then having to have a catheter replaced while you're awake. But after that week of a catheter, most men are able, 95% of men are able to return to their normal activities sort of in that week.